Hello again. Welcome back to the Lifestyle Medicine course. I'm a little late getting my post up this week for the video on the just a few comments on the modules chapters, but I wanted to just comment on a couple of things I think that are important to keep in mind when we're talking about high blood cholesterol, and diabetes this week. One of the things I want to tell you a little story first. When I was back when I was doing a clinical fellowship in cardiovascular research, I was doing inpatient work at a hospital here in Omaha, and one of the residents that was training to be a physician, I happened to talk with on the floor, and she was talking about one of her patients that had high cholesterol, and so we were just sort of talking about the type of treatment and what drug and that kind of thing. And she made the comment that, because she asked about, or I asked her about lifestyle components, and she said, I don't even talk to them about lifestyle anymore because it's just as easy to give the drug, or it's easier to give the drug, and so it's just kind of a waste of both of our time to talk about the lifestyle. And her point, she went on to talk about how the drug reduces cholesterol more so than what exercise can do, as far as the good cholesterol, bad cholesterol. The LDL is what she was talking about. And so it really was an interesting kind of shift but it really hit a nerve for me, because what it showed me was that sometimes we have really a tunnel vision about what lifestyle behaviors do for health, and that if we're just only focused on lowering cholesterol, then there is no comparison between exercise and giving a medication for it, like Lipitor or something like that. But if you think about the reasons why you give medication for someone who has high cholesterol, it's to ultimately reduce their risk for having a heart attack or a stroke. And that's the same reasons why you want them to do lifestyle also. So it's really a narrow-minded view that I think is more common than not, unfortunately, because I've come across it other times before from talking with folks, and that they just look at exercise as or eating differently to manage something like cholesterol as just focused narrow-mindedly on just reducing the level of cholesterol that you measure. And of course, we know that there's a lot of other benefits to lifestyle activities, and that's the reason you do them. I do have to say, though, that exercise, just in defense of exercise, it increases the good cholesterol level as well as any drug out there, and it also reduces triglyceride levels about as well as anything else out there also. Of course, in addition to that, it decreases risk for cardiovascular disease and stroke all by itself, regardless of medication. So there's a lot of arguments, and that's part of what's in the book is so that we all have kind of some scientific basis for arguing what the benefits of lifestyle medicine or healthy lifestyle behaviors are. And that was it was an interesting lesson. I learned it early on in my career, and it's stuck with me ever since, to remind people of why you are talking to them about lifestyle. It's not just about numbers, blood pressure, cholesterol, blood glucose, body weight. It's not, those numbers are fine to measure, but it's not all about them. It's about much more than that. And there's a lot more to benefits of exercise and eating right and sleeping and decreasing stress and alcohol and tobacco and so on and so forth than just measuring numbers. There's one other story that I'd like to share with you also related to diabetes. As you know, we have a cardiovascular and diabetes risk reduction program here at Creighton for our employees. And one of the people that was in the program, or still in the program, from the very beginning, this program started in 2008. She's been in it since 2008. And somewhere in, I got to get the year right, probably 2011-ish, 12-ish, somewhere around there, maybe 13. Hard to keep track these days. Um, she, we, what one of the things that we wanted to do for Creighton was we knew that there was a certain percentage of our population that had diabetes and didn't even know they had diabetes. And the reason we knew that is because we know that about the population at large. And so just working down the numbers, we knew there's probably a percentage of employees at Creighton that are just right on that verge of diabetes or have diabetes and don't even know it, neither do their physicians, and not on medications, not being treated and whatnot. So we figured out a protocol working with our annual health risk appraisal that our employees complete along with blood work that they complete on an annual basis. We figured out a way to predict how many people had diabetes, and then we actually were able to find them. And we won't get into the details here. If you'd like to know, let me know, and I can shoot you a paper that I wrote up as a case report on it. But long story short, is first year we did it, we found about 11 employees who had diabetes, and they didn't know it. Their physicians didn't know it. And so we worked with a third party who was doing the blood draws to have them send a letter out that I drafted, and they sent to their home address and said, based on your blood work, we think you might have diabetes, but why don't you go get it checked with your physician, and if you would like, we've got a cardiovascular and diabetes risk reduction program that you can participate in. Well, a couple of days after the letters went out, I got an email, or I got a phone call actually from someone who was one of the original people in the program, saying that she got a letter. Now, you should know that the reason we used a third party, I didn't know who the people were. They were completely blinded to anyone who worked for Creighton, just to protect their privacy, their medical records and privacy and whatnot. So I didn't know who the letters got sent to. So this gal calls me up. By this time, she'd been in the program for a number of years, and I knew her very well. And I said, I was shocked, because on a regular basis, at least 3 times a year, I was measuring her blood glucose and measuring her cholesterol and blood pressure and whatnot. And she, since the time she started the program, she had lost quite a bit of weight. She had been exercising consistently for a number of years at about over 200 minutes a week. And we had modified a great deal of her diet, and just everything was as you would hope it would be. So I said, well, let's come in and let's draw it again, and we'll see. What we were measuring was a blood glucose along with a hemoglobin A1C. If you have any interest in what that means, just let me know too. So anyway, it turns out, sure enough, she had diabetes. She had just within the last 6 months or so kind of turned that corner and went over a threshold from being pre-diabetic to being diabetic. And the reason I tell you this story is she was doing everything right. And initially she was very disheartened about it. And, thinking, God, what else could I do? I'm trying to do everything right. It made so much gain. And it was a good lesson for her. It was a good lesson for me to recognize the importance of genetics in how it plays a role in risk and chronic disease development. And she did have a very high risk for a family history risk of diabetes, which of course we both knew, but we were mitigating that with all the lifestyle interventions that she was doing. And so what we did, just to kind of finish out the story for her, is we doubled down on her intensity on nutrition. She didn't want to take medication. And so what we did is we partnered up with a dietitian, looked at her food intake more closely, made some modifications. Sure enough, within a month or so, she came back out of diabetes. We get her blood glucose level down to a range that was back where we were initially measuring it for a number of years. And she's still there. She's still not taking medications for it. She has been able to stave off diabetes just from lifestyle. The point the reason I bring this up really is twofold. One, for you to remember that we can do everything in our power to try to decrease blood pressure, cholesterol, and diabetes risk. Genetics is an important piece that you always want to make sure you're monitoring, and it can sneak up on you if you're not paying attention. So it gives a lot to credence to reminding patients, clients, participants, whatever you want to call them, that to regularly get blood work done to make sure that their numbers are where they're supposed to be to decrease risk. The other part that I want to remind too, and the reason I bring this up, is that we were probably, for her, she was probably holding off this diabetes for a number of years, and while she was in the program with the lifestyle, until it snuck up on her, so there was a lot of good happening that you just don't know about that's going on, and that's the point I wanted to make. Is sometimes like this resident with the cholesterol, and like this individual in the program, sometimes you don't know all the benefits that you're getting from doing the lifestyle activity, and sometimes you can't measure them as easily, and so you don't realize that it's happening, but they truly are, and it's important to keep that in mind and to remind folks about that. So I hope you enjoy reading the chapters in the book. I'm enjoying the discussions. You guys are doing a great job on the discussions, and keep working on your self-care project. I'm looking forward to seeing that. Also, that's a cool project. It's such an important. Lots of good things come out of that project, and I'm looking forward to reading those. So, if you have any questions about the material, about the project, about the course, just let me know. I'm here for you. Thanks.